Good afternoon, everyone, and welcome to this important session on Knowledge is Power, Understanding Cancer Risks, Prevention, and Early Detection. I am Avantika Chaurasia from Vedanta Lanjigar Corporate Communications team. I would like to extend a warm welcome to all our participants today. Thank you for joining us on this significant occasion as we observe National Cancer Awareness Day. This day holds immense importance as it serves as a reminder for all of us to prioritize our health. Today's session is focused on a crucial area in healthcare, cancer prevention, and early detection. With advancements in medicine and research, cancer is no longer an insurmountable challenge. Understanding the risks, adopting preventive measures, and seeking timely medical intervention are key strategies in reducing the impact of this disease. Our expert today will take us through various aspects of cancer, its prevention, and the vital role of early detection, how early detection plays in ensuring better treatment outcomes. Now, let me take you through the flow of the session first. And we are honored to have a renowned doctor with us today who will share their valuable insights on cancer and its prevention. Let me introduce our esteemed speaker for today. Please welcome Dr. Shravan Nadkarni. Dr. Nadkarni's exceptional journey in the field of surgical oncology is marked by his outstanding achievements and dedication. With advanced training from prestigious institution and a gold medal for his exemplary performance, he brings a wealth of knowledge and a meticulous approach to patient care. His expertise in minimal access surgery and his numerous contributions to medical literature underscores his commitment to innovation and excellence in cancer treatment. And as we move forward, we encourage you to be an active participant in the session. If you have any question during the talk, please feel free to type them in the chat box. And at the end of the session, the doctor will address as many questions as possible. Over to you, doctor.
Thank you so much for that kind introduction. I don't deserve such nice praise, but it has been a journey for me from being a general surgeon, to being a specialist in cancer. I trained from the Tata Memorial Centre, Mumbai. I was there for about 4.5 years. After that, I have worked in Hubli, and now I am in BALCO Medical Centre. Very thankful for this kind invitation on the eve of National Cancer Awareness Day. As they say, being forewarned is being forearmed. So you need to know the disease well. You need to know things to understand it completely, and take steps to sort of get an idea about what the disease is. So I'll give a mix of both Hindi and English so that we are able to reach out to as many people as possible. Some terminologies which may not have a proper Hindi translation, I'll be using English, so I hope that is not a problem. I am Dr. Shravan Nadkarni. I am a surgical oncologist. I treat cancers with surgery, and there are multiple other treatment options as well, like chemotherapy, radiation, immunotherapy. All these things, they work combined. So it's not one particular isolated modality of treatment. We treat cancers because it's a multimodal approach. So we need to treat cancers depending on what stage it is, what type of tumor it is, what site of tumor it is, and what is the age of the patient, and all those things. Before we get into that, let me give a small introduction about what this disease is about. Most of us, we know diseases like diabetes, hypertension, and things like that. But cancer is something which has recently come into the focus more because of its rising incidence in India. We have traditionally seen that cancer had a very high incidence. Even now, the incidence is much more in the West. So in Europe and US, the cancer incidence is very high. You also see a lot of incidence of this disease in Southeast Asia, like Japan, Korea, and that area. But we have now seen that even in China and India, the incidence is rising significantly more because, for one thing, we have a larger population, and the other thing is our lifestyles are changing. So, even 15 and 20 years in the past, people may not have heard so much about cancer. People may not have heard, हाँ किसी दूर के रिश्तेदार को हुआ था, इतना ही पता है. But now I'm sure in all the participants that are there today, you will have heard at least one family relative or some friend or some acquaintance who has gone through a diagnosis of cancer and has taken treatment. So we need to know what this disease is all about, how to treat it, how to prevent it, whether early diagnosis helps in the treatment, and whether it is able to be cured completely. So cancer, to define it, it is uncontrolled division of cells. So as the human body keeps growing, the cells keep increasing in number. It is at this point where if some cell or some group of cells become self-sufficient, that is, they are able to divide without any checks, without where they acquire the ability to get blood supply for itself, food for itself, nutrition for itself, then it takes the form of a tumor, which keeps growing. Tumors can be benign or malignant. So benign is something which does not spread, and malignant is something which spreads. So we use the term cancer when the tumor becomes self-sufficient and is able to spread beyond its anatomical site. तो अगर बहुत लोग बोलते हैं कि मुझे ब्रेस्ट में ट्यूमर हुआ है या पेट में ट्यूमर हुआ है, तो ट्यूमर इज नॉट नेसेसरली कैंसर. It becomes cancer when it is acquires the ability to spread. So it increases in size and it is able to spread to other organs like lung or bone or other sites. So depending on the site, the cancers are classified. So in the body, wherever there are cells, cancers can occur. Whether it is the head and neck, whether it is mouth, whether it is the food pipe or the gastrointestinal tract, the kidney, bladder, everywhere. So cancer is all pervasive. That is, you can have cancer all throughout the body. One of the aspects of treating cancer is that the treatment is dependent on what the site of the tumor is, what the type of tumor is, and even in the types, there are multiple other variants depending on which we decide the treatment. So coming to the symptoms of cancer, again, as I said, it depends on where the site of the tumor is. So something like a head and neck cancer, that is, there is a tumor in the oral cavity, for example, then usually there is a non-healing ulcer. एक कोई छाला होता है जो भरता नहीं है. छाले तो हम सबको होते हैं, बट वो एक दो हफ्ते में भर जाते हैं. लेकिन अगर कोई छाला है जो बहुत हफ्तों तक या महीनों तक रह रहा है और उसमें से ब्लीडिंग हो रही है या फिर कुछ गांठ बन रही है, देन इट इज अ साइन ऑफ कैंसर. फूड पाइप के कैंसर में हमने देखा गया, हम देखते हैं कि निगलने में तकलीफ होती है, खाना खाने में. सो मेनी वी डोंट इवन थिंक बिफोर वी swallow food. But there are times when we see patients coming in the OPD and they tell us कि सर पानी और दूध पीने में कोई तकलीफ नहीं होती, लेकिन जब रोटी या सब्जी खाते हैं तो छाती में अटकने का ये होता है. That is one of the symptoms of esophageal cancer or food pipe cancer. People who are known smokers, they can develop lung cancer, which is manifested. The symptoms are कि हमको थोड़ा ही चलने से सांस फूलने लगती है, या फिर छाती में दर्द होता है, या पीठ में दर्द होता है, कमर में दर्द होता है. These are again symptoms of lung cancer. You have cancers in the gastrointestinal tract, that is in the abdomen, that is पेट में अगर कैंसर होता है तो क्या होता है, कभी कभी पेट में दर्द होना, या फिर बावल हैबिट्स में चेंजेस होना, कि जैसे पहले एक बार बावल इवैक्यूएशन कर दें, मतलब एक बार मॉर्निंग में फ्रेश हो जाएं तो सब ठीक रहता था. बट नाउ रिसेंटली देयर हैज बीन अ चेंज इन द बावल हैबिट्स, दैट इज द नंबर ऑफ टाइम्स हैव इंक्रीज्ड. कुछ लोग बोलते हैं कि सर पहले मुझे एक टाइम बावल खाली करने से पेट साफ हो जाता था, बट अभी 6-7 बार जाना पड़ता है, 8-10 बार जाना पड़ता है. अगर लैट्रिन में खून निकलता है, अगर पेशाब में खून निकलता है, यूरिन में ब्लड आना, ऑल दीज थिंग्स, ये सारी चीजें जो हैं, ये कैंसर की ओर हमको आकर्षित करते हैं. महिलाओं में ये देखा गया है कि अगर स्तन में, मतलब ब्रेस्ट में अगर कुछ लंप हो, जो काफ़ी दिनों से वैसा ही है, उसमें कभी कभी उसमें साइज बढ़ जाता है या पेन होता है. Quite a lot of these breast lumps are without any symptoms, तो they are more likely कि हाँ नहीं वो breast में lump है, वो काफ़ी महीनों से है, उसमें कोई फर्क नहीं पड़ा है. तो women tend to ignore these things. So it is something that needs to be seen by a clinician, a doctor, and diagnosis has to be created, because quite a lot of lumps in the breast can be non-cancerous, but even if there is a small chance that it could be cancerous, then it has to be treated early on. Other cancers which affect women are gynecological cancers, like people who have some sort of vaginal bleeding after menopause is a very, very significant sign of uterine cancer or cervical cancer, and so on and so forth. There can be cancers of the bone, the soft tissue, any cell. There can be cancers of the brain, of the blood. So there are many, many different types of cancer. So how do we diagnose cancer? So even now, largely the diagnosis of cancer is dependent on what symptoms the patients present with. So the symptoms that I already mentioned. So if you have something like a difficulty in swallowing, then we do an endoscopy to see if there is any problem, if there is any tumor, then we take a biopsy. A biopsy means taking a small bit of tissue from the tumor to identify what kind of tumor it is and what would be the best course of action ahead. Some other symptoms blood in the urine or blood in the stools or blood when you cough. So these are all things which require different modalities of diagnosis, with CT scans, with endoscopies and biopsies, and sometimes evaluation of bodily fluids. So this is as far as diagnosis is concerned. A diagnosis of cancer is only confirmed after a biopsy. Imaging will tell us the location of the tumor, how big it is, what are the neighboring structures that it is involving. But the final diagnosis always, this is decided by a biopsy. So this is how we diagnose a cancer. As far as treating cancers are concerned, so as I said, I am a surgical oncologist. I operate, that is, I remove the tumor with the help of surgery, and that is how we treat the cancers. And surgery, even today, remains the most accurate and curable method of treating cancer. Chemotherapy, radiation are other modalities whereby we ensure that the tumor is reduces in size and they become operable. That is when chemotherapy and radiation is given before surgery, or it is given in after surgery. That is called adjuvant treatment. That is in a way of trying to destroy the cells of cancer which were not possible to be removed by surgery, and to prevent the cancer from coming back again. You should understand that cancer is a disease which keeps coming back again and again. So why does this happen? This happens because there are mutations in our genes which give cells the ability to turn cancerous. So these genetic mutations are what make the cancer keep coming back. आपने सुना होगा काफी कि वो 5 साल पहले उनका कैंसर हो गया था, उन्होंने ट्रीटमेंट ले लिया था, अभी ठीक है, लेकिन 6 साल होने के बाद वो कैंसर वापस आ गया. तो अगर ट्रीटमेंट हो गया हो तो वापस क्यों आया, ये सवाल आता है मन में. तो दैट इज द जेनेसिस ऑफ दैट इज बिकॉज द म्यूटेशंस आर स्टिल देयर इन द बॉडी. So that is why the recurrence of cancer is something that is known. So after treatment, we keep advocating our patients to regularly remain in follow-up, so that if there are any changes in the body, that can be picked up early, and any cancer, any tumor that is picked up early, that is diagnosed early, has a significantly higher chance of getting treated and cured as well. So surgery is one way, chemotherapy and radiation is another way. And now recently you must have heard about immunotherapy as well. So immunotherapy is a modality of treating cancer which makes use of the body's own immunity in helping to recognize the cells which have turned cancerous and to destroy them. See, please understand that even now I have cells of which are cancerous in my body, and all of us, in fact, whoever is participating in the webinar, we all have cells of cancers in our body, but our immunity is capable of identifying them and destroying them. When this capacity gets surmounted, जब ये ताकत अपने शरीर की इम्यूनिटी की वो उससे बाहर चली जाती है, तब वो ट्यूमर जो है वो कैंसर का धारण कर लेती है. So immunotherapy exploits this ability of the body in trying to help the body's innate immunity to try and recognize the tumor and destroy these cells. Again, ये injections होते हैं immunotherapy के, but they can be used only in specific tumors and they cannot be used in all kinds of cancers. Abhi treatment for cancer has become very specialized and very personalized. So what do I mean by this is that cancer now comes with certain signatures. So these signatures are what we look for, and then we decide the treatment based on what signatures the tumor possesses. So it is just like having attributes. For example, I am Shravan. I have a particular weight. I have a particular height. My body makeup is like this. I have a particular skin color. So these are the various attributes of my being. Similarly, a tumor also has these kind of attributes. So the tumor can have certain markers which we try to diagnose, and depending on the presence or absence of these markers, the treatment is tailored. So no two tumors are the same, no two patients are the same. So depending on the patient, the tumor, the age, the characteristics, we try to change the treatment to deliver the best possible outcome. अभी काफी लोग जनरल पॉपुलेशन थिंक्स कि कैंसर इज इनक्यूरेबल. पहले ऐसा होता था कि 10-15 साल पहले किसी को अगर कैंसर हो गया तो अभी आगे का क्या, अभी मेरा जीवन क्या होगा, because we have not seen the cancers being cured, so to say. But in the last 10-15 years, there has been significant advancement in the treatment, in the modalities of treatment, and we are able to cure cancer, especially when we detect them early on in the course. That is why we come to this thing about early diagnosis. So any such symptoms that I listed out, anyone who is suffering from any such symptoms, please visit your doctor, and they should be able to evaluate the symptoms and then give us an idea about what are the chances that these symptoms can be due to cancer. Of course, age is a very significant part, and we have seen that usually cancers occur after the ages of 50 and 60 years. Very rarely we see it in younger people. But unfortunately, a trend that we have seen in India is that cancers tend to occur early. So we have seen patients who come at 35 and 40 years of age also with cancer, and this is a little worrying. And that is why this push is for early diagnosis. So just because a person is of a young age doesn't mean that he cannot have cancer. Cancer can occur at any age. As far as the risks and why the cancer happens, so one very significant component is of course the lifestyle. So most of us that we see now are lifestyle related, including smoking, tobacco, alcohol, and these kind of things, because tobacco has effects all over the body, including the head and neck, the breast, the gastrointestinal tract, you have the bladder, everywhere. It affects every part of the organ, and it is preventable. So preventable in the sense, just by stopping the use of tobacco and alcohol, you can significantly reduce your cancer risk. And that is something that we need to give our thoughts to. The other significant risk factor for cancer is our food habits. So what we have seen is with the westernization of lifestyle, it has so happened that quite a lot of these processed foods, eating red meat and all those things, which are more common in the West, now we are taking them into our lifestyle. That is another risk factor, specifically for colon and rectum. And that is something which we need to get away from. We need to have more fruits and vegetables in our diet. If I ask a question to our participants, how many of you have had fruits this month, or how many times have you consumed fruits this month? I'm sure it's not going to be too much. That is because we have moved away from natural foods and naturally occurring foods to more processed and fast foods, so to say. So that is another risk for cancer. So lifestyle is one very important thing. Fruits and green leafy vegetables, very, very important to prevent cancer. The other thing is having physical activity. So we are now in a situation where we spend 6 to 8 hours per day sitting in front of a computer with a sedentary lifestyle, not having much of physical activity. Again, a very important risk for cancer. So we need to have at least 1 hour of physical activity every day for 5 days a week, which is not too much to ask for, to be very frank. So some sort of physical activity, whether it is walking, whether it is running, whether it is gymming, weight training, anything. But then that physical activity needs to be present, because that physical activity will keep your weight in check, as obesity is another significant risk factor for cancer. And I'm saying this especially for all of us who have a sedentary lifestyle. These are minor changes that you can make, which will significantly reduce your the risk of cancer. One risk factor that we have seen in gynecological cancer, especially for women, is when they have early menarche and a late menopause. That is, the menstrual phase is prolonged. So that is when the risks for gynecological cancers increase. Of course, this is a non-modifiable risk factor, because you cannot decide for how long you will menstruate. But then uh, childbirth and breastfeeding are known to be protective for some gynecological cancers. So this is as far as the risks and concerned. How to prevent them, I have told you. About early detection, so we advocate screening mammograms for breast to prevent and early detection of breast cancer for all women over the age of 40 years. But one very important thing here is self breast examination, and this can be done by all women irrespective of their age. So, what is advocated is that you start self breast examination right from the age of 20, so that you understand your breast well, you understand your body well. And this has to be done monthly, so that you are able to assess the changes that happen in the breast over a period of time. And the best time for a self breast examination is about 3 to 4 days after your periods. So any lumps that you are able to palpate, any lump, even if it is painless, that needs to be seen by a doctor. Once it is clinically evaluated, then the doctor can decide whether you need further tests, whether a biopsy or a scan or something. Quite a lot of people, I get such patients in the OPD very regularly. नहीं सर, हम जब डॉक्टर के पास जाते हैं तो कुछ ना कुछ बीमारी लेके ही आते हैं. So, it is not that the doctor is there to diagnose something that is wrong with you. The doctor is there to diagnose something early on, so that you don't have the far reaching consequences of diagnosing something later in the disease process. तो अगर आपको नहीं पता है तो कोई बीमारी नहीं है, ऐसा नहीं है. अगर कोई बीमारी है तो वो जल्दी में पकड़ में आए तो उसको हमको अच्छे से ट्रीटमेंट करने में मदद मिलती है. I think, yeah, that's about it. That's about the risks, the prevention, and early diagnosis. I'd also like to dwell upon one very recent thing that has happened is human papillomavirus vaccination. This is especially for women. The cervical cancer risk has increased, and we have seen a lot of cervical cancer patients in our part of the country. And it is a preventable cancer, because human papillomavirus is an infection in the cervix that causes this. And vaccinations are available, especially for girls from 9 to 14 years of age and from 14 to 27 years of age. I would recommend you to consult a gynecologist or a gynec oncologist, or even any oncologist for that matter, for more details about when to get it, how to get it, and for whom it is recommended. These are all preventable cancers. So anything which can be prevented should be prevented, and knowledge is where the power is. With this, I'll conclude the talk. I would be happy to take any questions that you have, any issues that I would be happy to answer.
Thank you, Doctor. Thank you for such an informative and enlightening session. We have a few questions waiting in the chat box. So the first question is, what are the chances of cancer coming back after the treatment?
So, as I said, cancer is a disease which keeps coming back in the sense that it is a problem that is happening at the genetic level. तो when I say this, quite a lot of people ask, sir, हमारे फैमिली में तो किसी को कैंसर नहीं था, जीन्स में तो कैसे हो सकता है, मेरे मदर फादर को नहीं था, ग्रैंड पेरेंट्स को नहीं था, तो मुझे क्यों हुआ? So when I say it is at the genetic level, it is not that it has been passed on to you by your previous generations. It is the mutations that are happening in the body as we live. Because you should understand that today we are exposed to so many environmental influences which cause mutations in our body. Smoking, alcohol, they all cause mutations in the DNA, that is the genes, and that is where the genesis of cancer happens. So anything that is affecting the genes is always has a possibility of coming back. Now, having said that, it is again dependent on where the cancer is, because we have seen cancers at certain sites like the pancreas or the esophagus where the cancer comes back very early. And there are sites like thyroid or breast where the cancer, or prostate for that matter, where the cancer, after successful treatment, patients live very long without any problem. So it is very difficult to answer as to what the chances are of a recurrence as a blanket, because it depends on the site of the disease, what stage it was diagnosed, and what treatment was given. So usually the stages of cancer involve stages 1 and 2, which is the early stage where we are able to cure the cancer completely. Stage 3 is where it is locally advanced, where we need some sort of chemotherapy or radiation to downsize, that is, get the cancer in control, and then operate with surgery or something so that it can be cured. Stage 4 is where it is spread to either the lungs or the liver or the bones or other sites, where it is usually deemed incurable, and we give treatment only to control it. The chances of recurrence are always there.
Thank you, doctor. The next question we have is from Sisi Tarafdar sir from Vedanta Lanchigar. So
Yeah.
his question is, it is also said that to catch only a very few percent of cases early, screening a very large number of probable persons is not a good idea. What is your take on this?
Right. So a very important question Mr. Shishi has raised. So I agree with him that when you are screening an entire population, now you think about it, India has a population which is probably the second or the third largest in the world. Now, if you want to screen the entire population for cancer, it is practically not possible. So, what do? We screen for cancers where screening is known to give a survival advantage. And the incidence of this cancer is so high that even if you detect one cancer out of 100 people you have screened, then it is meaningful. That is why you have screening programs for breast, you have screening programs for colorectal cancers, you have screening programs for these cancers. You don't have screening programs for, say, rare cancers like gastric cancer or bone cancer, something like that. So screening is only useful when the incidence of that cancer is sufficiently present in the population, and when screening is able to give you a survival advantage. That means if you are able to find this cancer early on in the disease course, the survival of that patient is increasing, right? So that is why only a specific number of cancers are screened, and you don't have something like a full body scan or something which you see ads for these in laboratory businesses, so to say, where they say full body scan kar do, aapka pata chal jayega cancer hai ki nahi hai. So these things usually don't work. It is only available for specific cancers.
Okay, the next question is, what if we have history of multiple cancer in family?
I'm sorry.
So what if we have history of multiple cancer in family?
Right. So in the family, if you have had multiple cancers, we have to see something called a pedigree chart. So we have to see how closely these previous cases are related to you, whether they are first degree relatives, that is, if they are immediate relatives, whether they are second degree relatives, that is related to a relative, So all these things change, and there are certain syndromes. To give you examples, there is something called a Lynch syndrome, where you have increasing chances of colorectal cancers, uterine cancers, kidney cancers, and things like that. Then there is something called a BRCA mutation, that is hereditary breast and ovarian cancer has this mutation called BRCA, where you have increased risk of breast and ovarian cancers in the women of the family. So depending on the pedigree chart, we are able to understand in the family how many people have had cancer and on what type. And then we are able to classify whether this is due to the family, whether this is genetic, whether this is a part of any syndrome, and then we can diagnose it accordingly. Based on that, we can also predict the risk of the future possibility of cancer in the children of that family, and take steps to prevent them.
Thank you, doctor. The next question we have is, are women with PCOD and PCOS and other menstrual issues more prone towards cervical and ovarian cancer?
So PCOS, there is a slight increase in the risk, but it is not conclusively proven that PCOS definitely leads to endometrial or ovarian cancers. It is all to do with the increased exposure of estrogen in the body. So if you are suffering from PCOD or PCOS, then that needs to be treated adequately. And one of the very significant things is controlling your weight and taking the appropriate medication that has been advised. Whether you will have cancer or not is something which is very, very difficult to predict.
And one question we have is, what are the major life-threatening cancer and its symptoms?
Major life-threatening cancers, see, any cancer is life-threatening depending on the stage. So if you have a stage 4 cancer of any site, it is always life-threatening, in the sense that we are not able to completely cure them. However, having said that, there are certain cancers which are not that life-threatening. For example, a thyroid cancer or a prostate cancer, or even breast cancer for that matter. We have very, very good treatment modalities due to which the life is not at risk if detected early and treated adequately. Problem comes when these cancers are ignored for some time and they reach advanced stages, and that is when the problem starts. As regards the life-threatening symptoms of cancer, so any cancer which has progressed beyond the cure is something that can be life-threatening. Lung cancers where the breathlessness is so much that they are not able to breathe well is one form of a life-threatening symptom. Significant bleeding from either the mouth or from the anal orifice is something that is very difficult to control. If there is significant bleeding, of course, we do have methods by which the bleeding can be stopped. But yeah, these are some of the life-threatening cancers and symptoms. The outcomes of pancreatic, esophageal, gallbladder cancers are not that great. So we have a 5-year survival in the range of 20 to 30% for these cancers. Whereas there are good cancers, so to say, like the thyroid, as I mentioned, thyroid, breast, where the survival is upwards of 60 to 70% for 5 years. Yeah.
The next question we have is, we consume vegetable along with fruits on daily basis, but apparently most of it is having pesticides. Does it not affect our body? Would that lead to cancer?
Right. So, very important question. We see a lot of pesticides being used these days. The problem is you cannot avoid it. You cannot avoid pesticides. What you can do, of course, is before consuming anything, make sure it is cleaned well, so that the pesticide residue is not available. We don't know what the chemicals that are used in pesticides, they are carcinogenic, not carcinogenic. The oversight over these is not as significant as possible, because you need a lot of research to find out which pesticides cause cancers and to avoid their use. But what is in our hands is to clean those vegetables well, fruits well, before consuming. The reason that pesticides are there, that is why we are not consuming fruits, is not something that needs to be accepted. If you are worried about pesticides being used in fruits, then I think sourcing should be from areas where the usage of pesticides is less and organic output is higher. But consumption of fruits and vegetables is very, very, very important in preventing cancer.
Thank you, doctor. One last question is there. Is it advisable that after any particular age, men get checked for prostate cancer, or only proceed if any symptoms are there?
Right. So we need to understand that the prostate keeps increasing in size as age advances. So over 50 and 60 years of age, the prostate will definitely increase in size. It is something called as benign prostatic hypertrophy. So that is something that happens normally in all men. The problem comes when you start having urinary symptoms. So when you have enlargement of the prostate beyond a certain degree, that is seen by ultrasound, or if there are any symptoms which we term as lower urinary tract symptom like ड्रिबलिंग, बहुत सारे लोग बोलते हैं कि पेशाब रुक रुक के आता है या फिर उसमें कुछ ब्लड आता है या फिर देयर इज अ सेंस ऑफ इनकम्प्लीट इवैक्यूएशन कि पेशाब करने के बाद भी हमको लगता है कि पूरा पेशाब हुआ नहीं, something like that. So these are the symptoms where you have to consult a urologist and get a imaging done. And if there is any imaging, any suspicious lesion in the prostate, then that needs to be targeted with a biopsy or an FNAC, and that should conclusively prove the presence of cancer. There is also a tumor marker called PSA, that is prostate specific antigen. If this level of this tumor marker, if this is higher than a specific amount, then that needs to be evaluated. Of course, it is not specific for cancer and it can elevate even in benign prostatic hypertrophy, which is non-cancerous. So that correlation has to be done by your doctor. And if any such symptoms are present, then I would suggest to get a evaluation.
Thank you, doctor. So due to paucity of time, we won't be able to take more questions, but you can always write to doctor at the given email address I have dropped in the chat box.
Yeah.
Thank you, doctor, for such an informative and enlightening session. Your expertise and
Thank you
insights
so
have
much.
shed light on the critical aspect of cancer prevention and the power of early detection. We truly appreciate your time and dedication in sharing valuable knowledge that will undoubtedly help many of us make informed decisions about our health. To all our attendees, thank you for your active participation and questions. Thank you for the session.
Thank you.